And this morning we welcome from Logan Health the emergency room doc. We've got Dr. Jennifer Gemmill. Hi.
Hi, good morning.
Good morning. How in the world did you come to be in our emergency room?
Well, we visited Montana a few years back and fell in love with the area and just decided we needed to live here, and that kind of brought the family up here, and then I just, begged to the ER for a job and ended up in there.
Why the ER?
It's a question I get a lot. I really wanted to see all age ranges of patients, and that the ER allows me to do that. It's one of the few specialties where we get to see everything from birth to death. I also like that it's pretty unknown as to what's going to walk in through that door. So you really never know what you're going to see each day when you go to work.
Now I have each hour.
Yeah.
See, now I have a frequent user card.
Do you?
At the emergency room.
One of those, huh?
Yeah. Accident prone, I guess. But for a lot of people probably have never had to go to ER. What can they expect when they walk through the door?
Well, generally when you walk in, you're going to check in. You're going to tell the front desk what you're there for. They're going to perform an initial round of triage based on what your complaint is. And then they're going to do an initial assessment with some vital signs, get a little bit more information about your health history, what really is going on. And then if there's a bed available and there's not a long wait, then you'll go right to the back where you'll see one of the doctors, myself or my colleagues. And then we'll just start taking care of you.
Yeah. How many of you are there at the ER at any given time?
It depends on the time of day. As many as 4, as few as 1. It depends. Early in the morning, generally 1. At the height of the day, when the volumes are more high, we increase the staff, and there's 3 or 4 of us there.
So is it busier in the daytime than it is at night?
Usually.
Really?
The busiest time is actually the evening.
Kind of what I thought.
Yeah. So it tends to get a little bit busier after school gets out in the evening time, and then it will slow down in the early morning. Although, interestingly, around 4 a.m., we usually do get pretty regularly people coming into the ER.
Now, full moon, Friday the 13th, are there any cycles we should be aware of here?
Full moons surprisingly do provide more high volumes.
We do
see more people. There, I don't know what it is, but it happens.
People feel more assured, I guess, when they shouldn't.
I don't know.
We see all kinds of stuff on TV, these medical shows, and what happens in ERs, and some of it's pretty wild.
Yes.
Is that really accurate?
For the most part, no. Although this new show, The Pit, that came on about a year ago, of all of the shows that I have seen about the ER, that is the most accurate. And interestingly, they actually used emergency physicians as consultants on the show. Wow. And they were very intentional about making it accurate. But most of them, no.
I would imagine not quite so many personal interactions as they show on TV.
Yeah, they got to make it a little bit more dramatic for people to watch.
Really? Okay. How many patients do you usually see at the ER?
So our ER annually sees about 28,000. So that comes down to between 70 and 100 each day. It varies depending on the seasons and the day. Yeah. So
28,000.
It's a lot. That's an increase over the past 4 or 5 years. We're seeing a pretty steady increase.
And of course, we have population increase, which is feeding that probably.
Of course.
Well, there are just times when you can't get into see your primary care physician, which you probably would do anyway, and you don't have a lot of choice. And if you go to one of the urgent care facilities or one of the walk-in clinics, if it's serious enough, they're coming to you.
Yep, that's true. And I'd rather them come to me if the capability isn't there in the clinic or the urgent care. I'd rather them come over to the ER.
One of the things that amazed me is you guys seem to have a cart for everything.
We do have a lot of carts.
I had a nosebleed that wouldn't stop. Mm-hmm. I was amazed to find out you got a nosebleed cart.
We sure do.
And I thought I was one of the few that ever. I guess you get a lot of those, huh?
That's a really common complaint, actually.
Really?
Yeah.
Well, I don't feel so weird now.
Sorry, you thought you were special, didn't you?
Yeah, that's true.
Too much aspirin.
Yeah, well, they got it, that's for sure. Talk with us a little bit about your career in medicine. Where'd you go to school?
Yeah, so I went to school at the University of Illinois and then medical school in Chicago, at the U of I in Chicago. I then went into the military, did a civilian residency in Central Texas, and then went on active duty with the Air Force in San Antonio.
Oh, at Lackland Air Force Base?
Yes, sir. That was my duty station, and I served more at Fort Sam Houston, which had a combined Air Force Army residency program. So I was a teaching staff there.
Wow.
Yeah.
I spent about a year of my life at Lackland.
Yeah.
Yeah. Oh, boy. It was an interesting place.
It is an interesting place.
Yeah.
It is.
Okay, so all this brought you, and why did you choose the ER? You could have done anything in medicine.
Yeah, I really liked being able to do everything. ER physicians are kind of jack of all trades, and I like the variability and being able to do some procedures, and there's some things that I can do right away that make people feel a lot better, and that's a cool thing to be able to do.
That's a good feeling.
Yeah.
I was talking with my primary care the other day, and I said, in another lifetime, maybe if I'd had a little different attributes, mental attributes, I would want to be a doctor. The ability to heal people, to me, that is just that's got to feel just absolutely wonderful.
It does. It's a privilege. It has its frustrations because sometimes we can't, and that's frustrating for everybody. But when we do get to make that impact, it's rewarding.
I know we have PAs that go to places like Honduras and Ecuador and into Africa, and they just basic stuff like giving vaccinations. My gosh, these are things we take for granted that these little kids have never ever imagined.
Yeah, those are certainly experiences that I wish everyone in healthcare could have, just to get that perspective about how lucky we really are.
And the ship Hope and Doctors Without Borders and some of the things they're able to do with kids born with birth defects that would not have much of a life.
Yep. Yeah.
It's got to be an amazing thing. So who comes to see you at the ER?
Well, it feels like everyone comes to see us in the ER. But, there's some pretty common presentations, lots of chest pain. Pain is a big driver to come into the ER, pain anywhere.
I don't like pain. Do you, Robin?
No, well, you don't like the unknown quality of it. What's causing it?
That's a really good point. And the fear and the unknown is a huge driver.
And if it's chest pain, that can contribute to more chest pain.
It certainly can. It certainly can.
Yeah. So, what symptoms like chest pain is that usually mean you got a cardiac condition starting?
No, in fact, most times it doesn't.
Really?
So there's a lot of different things that can cause chest pain, and most of them are not life-threatening. It's our job to figure out if the patient does have one of those life-threatening abnormalities or emergencies. But I'm sure if you don't know any better, then it's going to feel like it's a life-threatening emergency. So it's our job to really reassure and then accurately diagnose.
And of course, related to what you do is the Alert Helicopter Program.
It is, yeah. I serve as the Alert medical director. I have been doing that for almost 3 years now. I love being a part of Alert. It's a wonderful program.
You fly?
I do occasionally fly with the crew. I don't do much when I'm flying with the crew except make them nervous, apparently. But no, I felt like it was important for me to get up there and see what their challenges were, and just see what they're experiencing up there in the air. It's a different environment for practicing medicine.
I understand space is a bit of an issue.
Space is a huge issue. In our helicopter, at least, we fly the Bell 407, and it's a very small cabin, so there's not a lot of extra space. They do a phenomenal job of utilizing the space that they have. We're really looking towards the future and expanding that helicopter into something bigger. So
a larger bird?
A larger bird, yes, sir. That's on the horizon.
But the ones you've got now can land right in the middle of a highway.
They can.
I saw one land south of Summers on Highway 93, and there's not a whole lot of space there.
Yeah, our pilots are phenomenal, and they've all flown in this area for a long time. They know the terrain like the back of their hand, and they can put that bird down in some really amazing places. We've had the crew land on frozen lakes and on the side of a mountain, and it's pretty awesome.
So when they come off of the Alert helicopter, that's when you guys jump in at the in the emergency room.
Yep. So they'll bring us that patient, and they'll give us their report and everything that they've done in the air, and then we'll take it over in the ED.
Yeah. And generally, that's pretty dangerous stuff. When they're being airlifted out, they've got to be pretty serious.
Yeah, yes, for sure. And our crew has some highly specialized training that allows them to really care for those sick patients. And we not only do scene calls, so where the bird will come land on the highway in Summers, but we also take patients from hospital to hospital. And those patients can sometimes be sicker. So we'll take patients who need a higher level of care that we can't provide in Kalispell, and we'll fly them to Seattle, for example, or to Spokane. And the crew is able to care for them.
That's the fixed wing aircraft.
Yes, sir.
Yeah. It just brought to my thinking about this is the fixed wing aircraft and flying people into Harborview. We had that terrible crash at west or east of Columbia Falls, and that high school student.
Oh yeah, Hazel.
Hazel,
Yeah.
and getting flown to Harborview.
Yes.
Have you ever spent any time at Harborview?
I have not, actually. I hope to never have to in the patient context,
Yeah.
but it's a great facility where, it's far, but it's great that we have the ability to take patients there.
What makes that such an valuable trauma center?
So it's a large academic institution, so they have a lot of resources, a lot of specialized surgeons and consultants who can really provide very specific specialized care. It's also a huge facility, so they have the capacity to take care of a lot of patients. So it's a great place. And yeah, that accident that really hit the crew hard. Hazel's accident. Those types of transports and interactions really stick with the crew, stick with us too in the ED. Those are ones you don't really forget.
Yeah. Let's talk a little bit about some of the more common conditions that perhaps are preventable, perhaps you could avoid a trip to the ER.
Sure. So I would say as far as preventable visits to the ED, trauma will fall into that pretty securely. There are many traumatic incidences that could have been prevented. Simple things like wearing your seatbelt, wearing a helmet, not taking a selfie on the side of Avalanche Gorge when it's wet.
Yeah.
Things like that. Just kind of people making questionable decisions that then lead them to have an injury. Of course, some accidents and trauma are they're just accidents. They can't be prevented.
Yeah.
When is it advisable not to drive yourself to the ER?
Yeah, so that's a little tricky because you never really know what's going on. Certainly, if there's difficulty breathing, that's a big one. If you're having difficulty breathing, you should probably call the ambulance. Traumatic injuries are another one where it probably is just faster to get to the ED in an ambulance, although it depends on where you are. We have a pretty robust EMS service here in the Flathead County, but some areas are a bit more difficult to access. Certainly up the North Fork Road, out as you head out towards Eureka, out towards Marion, those, the further that you get out from here, the longer it's going to take. So it's a little bit of a balance.
So call 911 and they'll route the emergency services to you under those circumstances.
Yep.
Now, my wife was having some sort of symptoms, and I took her to after hours or walk-in clinic in Whitefish. And they did an EKG, and they said, I'm kind of concerned about this.
Sure.
Heart, Kalispell has heart as opposed to North Valley up there. So she said, do you want me to call 911? I said, no, I'll just take her because we had the car, and I didn't need to be in two places at once.
Right.
And thankfully, when we got there and she went through the protocol and everything, if they had had access to other EKGs, they would have seen that it was not something to be alarmed at.
Yep.
Her cardiologist says, that's nothing.
Yeah.
So,
they're going to err on the side of caution usually if they can't compare it to a previous one. But,
yeah.
But
So
if you start having chest pains,
yeah.
don't drive.
Yeah, again, it's a little bit tough, but chest pain's a pretty reasonable one to call the ambulance for.
I'm guilty of that one.
Yeah.
I drove myself in.
Yeah.
And boy,
Now,
they
here-
said, you...
Yeah, you shouldn't
I've
do
been
that.
called stupid a couple of times,
Yeah.
and that was the first time.
Well, it's the unknown. So if you had been having a heart attack and you went unconscious behind the wheel, then you're going to
Yeah.
put yourself in a position to not
Yeah.
only worsen your own situation, but also those around you. So that's, but you never know.
Now
Yeah.
I've read that's why I'm dangerous. That if you're driving and you start having some sort of symptoms, that if you cough regularly in a regular rhythm, it does
Oh,
something.
let's
to keep
see
your
if
heart
that's
going.
a real deal, Robin.
Well,
let's
it can't
maybe
hurt.
not put that out there for the general population there, Robin.
Is that an old wives' tale?
I don't know. I've never heard that one, but I don't think that I want to give it a try.
Well, the fact is, if you're behind the wheel and it's coming on, I think I would cough to get to the side of the road. So anyway, well, that's why we have medical professionals in
That's
here,
right.
John. I don't know what I'm doing, but I've made it this far. Yeah.
If you could give somebody one piece of advice on coming into the ER and maybe preparing for it, what would it be?
I would just say that we have a very well-practiced and accurate way of triaging the patients who come in. Triage means assessing their level of severity and placing them in the queue of the patients in an appropriate way. And just please allow us to do that. We recognize that when you're coming into the ER, it feels like an emergency, and sometimes it will be. But that doesn't mean that that the person in front of you isn't also having an emergency and might be sicker. So we will take care of you. It just might take a little bit of time, but
Bring some reading material.
reading material is a good idea.
All right. This has just been a fabulous conversation. I really do appreciate you spending time with us, Dr. Gemmill.
Yeah, thank you for having me.